Thank you, and welcome everyone to the final meeting of the Ipswich and East Suffolk CCG governing body, which is being held in common with West Suffolk CCG governing body and North East Essex CCG governing body today. So my name's Mark Shenton. I'm the GP chair of Ipswich and East Suffolk, and I'll be chairing the meeting through to its conclusion, which will hopefully be over the course of the next hour or so. Have we got any apologies for absence to note, please, Jo?
Yeah, so apologies for absence from Ipswich and East are Steve Chicken, Graham Leaf, Aisha and Richard Watson. And from West Suffolk is Steve Chicken, Jeff Dobson, Godfrey Reynolds, Richard Watson, Victoria Wilson and Andrew Yeager. And from North East Essex is Frida Batty, Pam Donnelly, Martin Hanlon, Max Hickman, John Price and Richard Watson and Daniel Land.
Thank you. Thanks, Jo. So, declarations of interest and any hospitality or gifts. So I'll take any declarations of interest, hospitality or gifts pertaining to this meeting. Anything over and above already declared conflicts of interest. I don't see any hands going up, in which case I'm going to hand over to Christopher Browning. So Dr. Browning, if you wouldn't mind taking us through the next two items for the West Suffolk system. Thank you.
Okay, thank you. So we have the minutes of the governing body from the 25th of May. Those present, do you approve those as a correct record? Thank you. Are there any matters arising from those minutes that need urgent discussion? Thank you. And the action log in the West is now clear. So that concludes my part here. Thank you.
Thank you, Christopher. And over to you, Hassan, for the North East Essex side.
You're on mute, Hassan.
Had to happen today, didn't it? Thank you, Chair. I'm Hassan Chan, I'm GP Chair of North East Essex CCG. So for those present from North East Essex CCG governing body, could I ask that they're happy and content with the accuracy and content of the minutes from the last board meeting?
Yes.
Thank you. And can I then take us to our action log? We've got two outstanding items. First, Amanda, I don't know whether you're able to just give an update as to whether you've had that conversation, please.
Yeah, thank you very much, Chair. So I have emailed Myrna with an explanation following on the conversation we had at governing body. I think we can close, but my offer to Myrna would be that we can still have the conversation to satisfy yourself, Myrna, on joint appointments going forward. So that's where we are, Chair.
Thank you, Amanda. And the second outstanding item, I actually received an email from Richard to confirm that this was additional activity. So I think we can close that action log. And if anyone's interested in the real figures, then I'm happy to forward on that email if you let me know. And unless there's anything else, I think that concludes my part, Chair.
Thank you, Hassan. And for Ipswich and East governing body members, are you happy to approve the minutes of the last governing body on the 24th of May? Does anyone have any objections or corrections that they wish to make? I don't see any hands up, so thank you. We'll approve those. And going on to the action log, there was one action in there from the integrated performance report, Lisa, around the stroke performance at Ipswich Hospital.
Yes, so we're continuing to look into it, really. And Andrew Kelso, our new medical director, has a meeting with Angela Tillett, the medical director at ESNEFT. Now we have the SNAP data to really understand it. So I don't think we can necessarily close the action because I don't think it's complete. But I wonder whether whether we would be best taking the follow-up through to the Urgent and Emergency Care Board or the Stroke Board. I don't know. I'll be guided as to where the best place is for it to go, because I don't want to lose the action.
So we had raised the risk via the Stroke Board, Lisa. So I think if it could come into somewhere within the ICB structures to ensure that there is oversight of the or some behind the improvement plan.
Okay. So therefore, maybe Joe Mail, could we take the action through to the ICB Quality Committee in July?
Yep. Okay. Yep.
Thank you.
Thank you, Lisa. Moving on to item 5, Ed Garrett, a general update.
Thank you, Chair. So I mean, my update is simple today. It's just a big thank you to all 3 governing bodies for everything that you've contributed over the last 10 years as well, as well as colleagues that aren't here for this meeting but have equally made a fantastic contribution over that time. I think it's unusual that all 3 have been absolutely outstanding. We've kind of pushed each other along in a very collaborative and healthy way, and I think we can now take this moment just to reflect that it has been a success, and we can be very proud of the legacy I think we leave, not only for how we've done over this period of time, but the fact that we've built 3 strong alliances to take forward that place-based working, which I know is very important to all of us. So I think the work we have done will thrive in the future in a new form. So a big thank you from me. We had governing bodies recently, as we all know, so I think my updates from those governing bodies haven't materially changed, so I won't repeat them, but the big focus obviously has been on the closure of the CCGs and the transition to the new ICB from Friday, which we'll start to get into from the next item. Thank you, Chair.
So did you want to extend on that, or
I can keep going if you'd like me to. Yeah.
Keep going.
Thank you. So I have a series of statements which I've jotted down, just which I'll read out in terms of good governance. So this final transition and governing body meeting forms part of the externally auditable closure reports and follows best practice when closing public organisations and transitioning functions to new organisations. The CCGs have taken account of, and to the best of their knowledge, complied with all of the transition guidance and consequent requirements that's been issued by NHS England. The CCGs have therefore, to the best of their knowledge, accurately identified and accounted for all contracts, proprietary interests, liabilities, assets and staff that will need to transfer to the ICB on or prior to the abolition of the CCGs at 12 midnight on the 30th of June 2022. Furthermore, this information has, to the best of the CCG's knowledge, been set out in the readiness to operate statement, which has been submitted to NHS England. CCGs have therefore, to the best of their knowledge, submitted all relevant details to NHS England in compliance with the transition guidance and requirements. CCGs will cease to exist as legal entities when the ICB is formally established at 1 minute past midnight on Friday, 1st of July 2022, in accordance with the powers of NHS England described in the 2006 Act. The main powers and duties of the new ICB to commission certain health services, hitherto the responsibility of the CCGs, are set out in the sections 3 and 3A of the 2006 Act. These provisions are supplemented by other statutory powers and duties that will apply to the ICBs, as well as by regulations and directions, including but not limited to those made under the 2006 Act. Following abolition of the CCGs, it will be necessary for the Chief Executive, the Finance Director and other persons identified by the CCGs to discharge responsibilities associated with the close down, including financial close down and accounts preparation. all matters related to the CCG's corporate governance structure, including the membership arrangements, governing body structures, committee structures and business processes, are fully detailed in their soon-to-be archived constitutions, standing orders and detailed financial policies. Given the imminent closure of the CCGs, we have made support of the transition a key priority in order to provide continuity, certainty and stability to areas of delivery and planning. As such, the ICS board has been fully involved in the development and approval of the ICB's governance structure and organisational arrangements. Thank you, Chair.
Thank you, Ed. Does anyone have any observations or questions for Ed on any of those statements? Didn't see any hands coming up. So thank you for that, Ed. Shall we go on to item 7? Lisa, quality and continuing healthcare, for us to note the ongoing quality and CHC issues being passed to the ICB.
Thank you. So the first paper is a summary paper really of all the risks that we have on the risk register in relation to quality, and it provides the final destination for those quality risks. So this is just about ensuring safe transition of risks into either the Alliance quality groups, the ICB quality committee or the ICB board. So you will note on the matrix all those risks. So we're just seeking approval, final approval, that you're happy to transfer those risks in that paper.
Any questions for Lisa on that? I know we had a good conversation about it this morning at Ipswich and East Suffolk clinical scrutiny, looking at those risks in particular. I don't see anyone making any objections to those being passed over.
Thank you.
Continuing healthcare report.
Yes, so the continuing healthcare paper just gives an overview of the 3 separate SNE risks that again will be transferred through to the ICB Quality Committee. So we will have 1 Suffolk and North East Essex risk in relation to the Liberty Protection Safeguard implementation, which as many of you will know, we've been on the journey of that together with still no defined date, but we continue to feel that there is a risk there that we need to capture. 1 Suffolk and North East Essex risk relating to Court of Protection authorisation and the impacts of any unauthorised restriction. And the 3rd risk, which relates to the care market workforce impact pressure, which impacts on CHC. So we are recommending that we take forward 3 Suffolk and North East Essex CHC risks to the ICB Quality Committee.
Thank you. So anyone with any comments to note on that particular issue relating to continuing healthcare? No, so that's good. Thank you. In which case we'll move to item 8, the CCG closure and ICB transition, the internal due diligence, assurance and national transfer order, and we're asked to note the content of the transfer order and in particular issues related to the transfer of people, contracts and property to the Suffolk and North East Essex ICB. Amanda.
Thank you very much, Chair. So I think the paper clearly articulates the story, the journey that we have been on for many months now. And as colleagues will see, the paper does confirm our completed internal due diligence and assurance exercises to enable the undertaking of the national ICB transfer order. We have, as 3 CCGs, followed a very robust due diligence process to enable the CCG to close down effectively and have the safe transferring of our staff and property to the ICB from the 1st of July. So in summary, I think we've had a very robust and thorough approach to all things people, workforce related, our approach to all things contracts. We've had necessary programme assurances in place. We've had robust ROS checklists, and we've had the required NHSE assurance meetings. So in conclusion, Chair, I think we have managed an excellent process. We have done everything by and still very confident that we've done everything necessary and required ahead of the 1st of July. Thank you, Chair.
Thank you, Amanda. And do we have any queries for Amanda on any of those issues there that we've been through? We've been immersed in it for quite some time, haven't we, and been included in the development of this as we've been working on it over, as Amanda said, many months. So it sounds like we're happy to note the content of that work, Amanda, and thank you. So shall we move on to the governing body assurance framework and the directorate risks, and to note and approve the ongoing risk management issues being passed to the Suffolk and North East Essex ICB, Amanda.
Thank you very much, Chair. So this paper articulates all of the risks that we propose we take forward into the ICB from the 1st of July. And as we can see, we have given the current risk rating and risk descriptor, which by all means are not closed, but continue to be effectively managed and mitigated from the ICB's perspective. In addition, it will be managed through each of the 3 alliances as well. And the current local risks pertaining to each directorate will still be managed appropriately and escalated to each alliance and ultimately the ICB going forward. So in summary, Chair, these are our live risks that we think we must continue to manage and mitigate as we move forward, and would be the subject of the ICB going forward.
Thank you, Amanda. And if anyone's got any comments, please do raise your hands. We've been managing this framework for a number of years now. As you say, it's a live document. It's regularly updated and reviewed through a number of our, not just our governing body, but other boards and committees within the CCGs. So if there aren't any hands up, it must be that we are happy to note and approve the ongoing risk management issues being passed over. So thank you for that. And then shall we move into the emergency preparedness, resilience and response, and to note the statutory responsibilities being passed to the ICB. I've got Paul Jabara for this, but I see.
You're on mute, Mark. I'll take it from here if that's all right.
Okay.
Okay.
Yeah,
Thanks.
sorry,
Thank you. The paper essentially provides assurance as to our readiness to take on Category 1 responder duties. As you know, we've been running a Category 2 responder for some time and running in shadow form over the last few years. I think the important point here that is to point out it is shaped by the Health and Social Care Act and the Civil Contingency Act, therefore now is a legal duty. It broadly breaks down to 2 core standards. One is about essentially being substantially meeting core standard as an organisation, but the other one is about having assurance as a system that we are compliant. And as you recollect across the 3 governing bodies, we previously brought back a report to say we were substantially compliant across the board. So again, really good foundations, I think, in terms of moving forward. The paper essentially goes on to talk about the various structures and the relationship in terms of local resilience planning and local health improvement plan and committees, and how that relationship is going to work, and essentially identifies me as the AEO moving forward in terms of fulfilling that legal duty committee again moving forward. So again, that culminated into a review by NHSEI, and you'll see at an appendix there is a letter confirming that we've been through a diligent process to confirm we are ready to take on that role moving forward into the ICB on the 1st of July. So I'll stop there. Happy to answer any question. Thank you.
Any questions that wish to be raised? Don't see any hands, so we appear to be happy to note the process and the responsibilities for EPBR being passed over. So thank you for that. In which case we come to item 11, the annual report and accounts. Jane Paling.
Yeah, thank you, Chair. So hopefully it's a reasonably self-explanatory paper. We are in the process of finalising the accounts for 21-22, which I'll come back to in a second. We also have to produce 3-month accounts for the period that ends on Thursday. So the various elements around the formal approval of those and the publication of the accounts in line with the NHS England timetable and making sure that we've got the audit opinions on those. The paper is basically asking the committees to pass that on to the ICB, which is what the expectation would be on that. So that's for all elements of the actual production of the accounts. Also, if we need to do a mental health investment standard audit on previous years, which is very likely. So in terms of updates on the 21-22 accounts that we spoke to part 2 governing body meetings, I can't remember if that was last week or the week before. The time is going into a slightly strange time warp at the moment because we are still in the hopefully now final stages of getting the audit signed off for the 21-22 accounts. We had a audit committee meeting of audit committee chairs on Monday. Thank you to Jerry who came along to that. We believe that most of the work is now completed and they are just finishing off the final few bits. As we reported to part 2, there was an element which was delaying the audit opinion around the classification of a particular payment we received yesterday, and information that that payment requires no further approval. So we are working through the implications of that with the auditors and NHS England, but hopefully we'll be in a position to sign all of the accounts off in the next couple of days. If it isn't before the end of the CCG, then the paper is asking for that to pass on to the ICB in due course. So obviously happy to pick up any questions either in the meeting or if people want to speak to me offline about any of that, but it's a straightforward ask that we just transfer all the responsibilities on now to the ICB.
Okay, so any questions? I just got a question. If there is something material arising, Jane, will that be taken forward by the ICB on behalf of the CCG governing body members? Okay, thank you. Jerry Wedge.
Yeah, thank you. Just a comment really at the end, and I've not had a chance to talk to Jane about this, but if I was carrying on as audit chair, I think I would want to speak to BDO at some point next year about trying to avoid all the last minute work, which seems to have been quite excessive this time round. I mean, we've had at least 2 post-final audit committees because things haven't been finished. So it'd be interesting to see what Jane says about that, but it might be an action to leave the new Director of Finance and Audit Committee Chair to speak to BDO about trying to improve their performance, really.
I think that's a very valid point, Jerry, and just to reassure the governing bodies, we have been, since following last year's audit, which also ran very late, we have been meeting with BDO very regularly and trying to keep them on track. They did do an interim audit, but unfortunately their audit manager has gone off sick, and well, in line with a lot of the audits across the east of England and nationally, things have been extremely thorough and late and have just taken an awful long time. But I think it's very appropriate to put that down as an action point, and we have already agreed with the audit partner that we will have a wash up exercise. But it's fair to say this has been the most grueling audit ever, and we're still not quite out of it yet. But thank you, Jerry, and the audit committee for all the audit committees for their support.
Thank you, Jane. So any other observations or queries? Don't see any hands, in which case we're happy to note the processes as outlined by Jane and the action around audit chairs with Director of Finance and with our partner BDO. And just on that issue that Jane was alluding to, this being a grueling exercise, I would like to thank everyone within the CCGs who've been involved with this enormous task relating to the safe and robust transfer of the working of our CCGs to the ICB. It has been an enormous task, but it isn't always about the quantity of the work, it's about the quality of it as much as the quantity. And I'd just like to pass on my thanks for quality being of an incredibly high standard. And again, thank you to all of your teams for being able to make this process as smooth as it possibly could be for the governing bodies. So it now comes to item 12, Chair's closing address. It's got my name next to it for mine, but I'd just like to invite Christopher if he would like to make any closing comment.
Thank you very much. Yes, I would like to echo your thanks and expand them both to everybody and also beyond the finance to all the work that's been done over the 10 years. Very grateful to the officer team and very grateful to the GPs, and to the officer team going forward. I would say, I hope you don't miss us too much, and I hope it carries on going as well without the GPs. Thank you so much.
Thank you, Christopher. And Hassan, anything from you?
There's only so many times you can thank everyone, isn't it? But I'll echo everyone's comments. So thank you, everyone. You know, it wouldn't have been possible to do this role without everybody at the CCGs and broader. So that includes all our system partners. And I am sorry that we haven't been able to do in-person boards, because actually I did miss the interaction with our public when they were able to come and fire questions at us and meeting people. So it's been a shame that we've ended it on a largely virtual footprint. But I do wish the ICB all the best for the future, and I really do hope it succeeds in ways that we weren't able to, because ultimately that's what makes a difference to my day job and the patients that we all look after. Thank you.
Thank you, Hassan. And from me, I don't think you can have enough thanks. More thanks, less spanks was a little mantra that we wanted to have as CCGs. And we really have come to the end of a decade of clinically led commissioning, but with a fantastic hope of multi-professional and community leadership now taking on the baton of that clinical leadership, and great to see that that leadership is expanding the way that we have wanted it to. And we're all aware of the continuing challenges facing the NHS, social care, and also our voluntary sector partners, and the ever increasing demand. Bless you, Pam, bless you. And the ever increasing demand posed by worsening deprivation, the pandemic, and now a persisting cost of living crisis. And with that environment, we wish the Integrated Care Board and our Integrated Care Partnership Board, our alliance, our integrated care teams and primary care networks all the best for their future and our future too. And I wish to thank everyone here on the governing body for their hard work, their dedication in helping us charter our way to this point of safely handing over the well-managed work into the next epoch. And to thank the staff of the CCG for grasping the nettle of integration and co-production and applying it in our work, and for their superb support to the clinical exec and governing bodies. Thank you for that. and alliance partners and our new friends in the block who've taken up and run with the development of real partnership working for that common purpose of better health and well-being for our residents. To our GPs, got to remember the CCGs are a membership club. That's how it was developed, and you know, they've been active members of the CCG. They've helped develop and spread the culture of collaboration and leadership and teamwork, and the high professional standards we should rightly be expecting. And lastly, I would like to thank our public who've shared their stories with us, who've taken an interest in the work that we've done, who've asked good questions, and helped us be better commissioners and honed the legacy that we now feel able to leave. So thank you all. And on that note, I'm going to ask if there's any other business before we close. I don't see any hands up for any other business. So thank you for being here. Thank you for your attention, and I wish you a good afternoon. Thank you.
Thanks, Mark.
Mark, just to let you know that I didn't receive any public questions.